Good afternoon, and thank you for being here this afternoon on March the 2nd of 2021. As you all know, 1 year ago today, I signed my first executive order aimed at limiting the damage of COVID-19. We had no idea what to expect. I do know that none of us, or at least I can speak for myself, I never expected all of this. Earlier today, I signed what I expect to be one of my last executive orders regarding COVID-19. This new order removes all of our county mask mandates and allows businesses to operate at full capacity without state-imposed rules or restrictions. If businesses or individuals decide to take additional precautions, they are absolutely within their rights. In fact, it may be smart. But we are not going to continue to use the heavy hand of government when it is no longer justified by the reality we see around us. Our hospitalizations have plummeted, and our case numbers have also fallen dramatically. In fact, our case numbers have fallen to the point where no county currently meets the original criteria that we put in place for a mask mandate. When our new order goes into effect, we will have done more than 700,000 vaccinations, targeting those who are most vulnerable amongst us to this virus. The majority of Mississippians over the age of 65 will have received at least one dose. I originally signed these orders, and I made very clear what my goals were. It was never to prevent all possible spread of COVID-19 because we viewed that as unrealistic. But it was always about protecting the integrity of our healthcare system. We wanted to ensure that it would never be overwhelmed with COVID patients so that anybody who needed quality care and could get better with quality care received that quality care. I understand that in many parts of the country the goalposts have shifted. But for me, that goal remains the same. Now, let me be clear. There is still risk to unvaccinated individuals who choose to interact with others, just as there has been throughout the last 12 months. There will still be COVID in our communities, perhaps for a significant amount of time in our state, as well as across the country. We will all need to decide for ourselves and our families how to assess the risk and rewards of each and every activity we choose to pursue. But the risk of overwhelming our hospitals with severe COVID cases is coming to a close and gets less and less every single day. We see more and more of our people, particularly those most vulnerable, vaccinated. That is because we have a new, better tool to combat COVID. Executive orders that interfered with people's lives were the worst, but the only possible interventions for most of the last year. You've heard me say this many times before. I never took any pleasure in signing executive orders. I did it because I believed it was the right thing to do for our people at that time. But now we are putting all of our focus towards the rapid distribution of the vaccine, and the governor's office is getting out of the business of telling people what they can and cannot do. Let's be honest. Throughout the last year, we as a state have been among the 4 or 5 most open states in America. And we've been rewarded for it with more jobs, a stronger recovery, and more economic activity. But that's not because the measures we put in place were a light burden. It's because the measures in the rest of the country were so harsh. We all need to recognize that none of these orders in our state or any other state are anything short of unprecedented, particularly when you think about the length of time we have been holding these very press conferences. We know that these orders have to end, and I have said repeatedly that these orders have to end at the earliest possible moment. By and large, this is that moment. Having said that, I also want you all to know that I am replacing our current orders with recommendations. Everyone in our state should continue to listen to Dr. Dobbs and our other health advisors for the best possible wisdom regarding how you can personally avoid any risk of catching COVID. You should continue to listen when we advise you as to the measures that can be taken to minimize that risk to you and your family. Their insight is valuable. Now, the only rules that will remain in place in this order are with respect to our K through 12 schools, as well as capacity limits of 50% on indoor arenas. I want to talk a little bit about why I chose to leave the measures in place with respect to K through 12. I chose to let them stay because I believe that the most consequential debate playing out in America today is whether children should be in the classroom learning. My view is simple. All of Mississippi's children should be in the classroom. All of America's children should be in the classroom. It truly breaks my heart to see other states to continue to force children to stay home and miss out on a quality education. For many of those kids, being out of the classroom for well over a year may be an obstacle that they can never overcome. I pray that is not the case. I'm thankful for the teachers. I'm thankful for our administrators. I'm thankful for the people in our schools who have gone above and beyond since the first week in August when we opened schools in Mississippi. It's not been easy. In fact, it's been very hard. I know that. But I also know that there's a generation of kids that are going to be better because of our willingness to make hard decisions to allow them back in the classroom. I want to make sure that I say this. I don't want to give anyone an excuse to act like those other states. So that is why I am not rolling back the restrictions, either mask mandates or otherwise, in our K through 12 schools. In my view, this is the way forward. As more and more people are vaccinated, there will be more and more immunity throughout our state. This is a far better way to flatten the curve and prevent our healthcare system from being overwhelmed. Please, though, continue to use your best judgment. Please continue to look after your loved ones. There is no replacement within the government for good common sense. Simply because there is no longer an order in place doesn't mean it doesn't make sense to continue to take necessary precautions. I want to thank everyone again for being here today, and I want to turn it over to Dr. Dobbs to give us an update on where we are, and particularly the exceptional good news that we've both gotten over the last several days with respect to the third vaccine, which is going to allow us to distribute even more quickly. Dr. Dobbs, thank you.
No, thank you very much, Governor. So today we're reporting 301 additional cases, but 44 deaths. A stark reminder that we're still seeing significant coronavirus transmission and deaths. So we're not out of the woods, so we still need to be careful. We are fortunate to have new tools. We have vaccines available that are highly effective, not only at preventing illness and severe illness, but growing body of evidence that it does also prevent transmission, further reinforcing how important it is for folks to get vaccinated. We're putting out new public health guidance that very clearly outlines for people over 65, or if you're someone with a chronic medical condition and over the age of 16 that puts you at higher risk, we are strongly recommending that you do not attend any social activities or any mass gatherings at all until you get vaccinated. All of these folks are eligible to be vaccinated, and if we want to really have an impact on our hospitalizations, morbidity, and mortality, we need to make sure that we get as many vulnerable Mississippians vaccinated as quickly as possible. So where do we stand on that score? And I think on some measures we're doing extremely well. If we look at people who are 75 years of age and older, 50% have received at least one dose of COVID vaccine, and a large proportion of those are fully immunized. If we look at people 65 and older altogether, we're at about 45%, so we're making good progress, but we're not there. We want to protect everyone who's most vulnerable, so before we start opening up a little bit, on a personal basis, please get vaccinated before you do any mass gathering, including church, funerals, sporting events, weddings. Get vaccinated, get protected. The same thing goes with when we look at younger folks who have chronic medical conditions. Please get vaccinated. We have a pretty broad criteria of who's eligible to get vaccinated right now. It includes everyone over 65, people with a whole host of high-risk conditions, over 16, first responders, public safety, healthcare workers, and teachers, and also in daycare. So it's a lot of folks. So please get vaccinated. We are making great progress in getting vaccine out there. We've done well over 600,000 vaccinations, and that is growing daily. We did over 132 vaccinations last week, and if we do less than 150,000 this week, I'm going to be very disappointed. So that's the kind of performance we need to expect going forward over coming weeks, and that makes a big dent as we kind of go forth. We're also making great strides in our health equity work. We have identified very clearly that African Americans were very much under-vaccinated as a proportion of the population, with the lowest weekly value being at 13.5% of vaccine utilized. And that's in a state with a population of about 38% African Americans. But just this week, we logged 30% of vaccines going to African Americans. So you can see that we've almost tripled our impact in the black community. So that's something we'll continue to work on until we get to really where it needs to be, where there's true equity. We're still working aggressively with our Hispanic or Spanish-speaking population. We're still lagging, and also in regular communications with our friends at the Mississippi Band of Choctaw Indians to make sure that they're protected as well. We do have a new tool available now. We have a new vaccine, Johnson & Johnson, also referred to as Janssen vaccine. It's a collaborative effort. It's a single-dose adenoviral vector vaccine that has been shown to be highly effective at preventing severe illness and death. To be clear, it does not show the same efficacy at preventing any symptomatic illness, but where it counts, it looks good. And even with the variants that have been identified in South Africa and other places, there is still some significant residual protection, so we're very excited to have this in our tool chest. Again, a single dose with easier storage characteristics. We have been allocated 24,000 doses of vaccine this week of the Johnson & Johnson. Of those doses, 8,000 are going to be allocated for special drive-through events. We're adding additional clinics this afternoon for people to go ahead and get vaccinated with the one-dose Johnson & Johnson. You will be able to select a Johnson & Johnson location, so if you want to get that vaccine, you will choose that vaccine on that Johnson & Johnson day. And if you'd rather have Pfizer or Moderna, then you can choose one of the other dates and locations. So please, it's a choice. We're also sharing the additional 16,000 doses with partners throughout the state. This week, we're going to share our vaccine to 101 additional partners, in addition to the locations that the federal government has chosen with the federal pharmacy program. Even now, in the state of Mississippi, there are 188 locations where people can get vaccinated across the state of Mississippi, and that excludes the drive-through locations. More and more places are becoming available to get vaccinated, so please go to healthyms.com, look at our COVID vaccination page. We have a vaccine finder. We're going to continuously update it so more and more people will know where and how to get vaccinated. And that's all I have, Governor. Thank you.
Thank you, Dr. Dobbs. Just to give everyone, just so that we're all on the same page, 2.8 million doses of Johnson & Johnson will be distributed nationally this week. That's because they have been manufacturing this vaccine for a number of weeks and months. And we'll see a slight drop-off, perhaps a larger drop-off over the next couple of weeks, and so we won't get 24,000 a week through March. However, we do believe, based upon the call that I had with the task force earlier this morning, that by the end of March, early April, we should be getting at least that much and probably a good bit more of the J&J on a weekly basis going forward. And what Dr. Dobbs said, which is so critically important, is we've got fantastic reach with our mass vaccination sites, but I think it's been very, very smart that we've also worked with our partners, hundreds of them throughout the state, because as we move into late March, early to mid-April, when we may find ourselves in a slightly different position. Right now, we still have a scenario in which demand far exceeds supply of overall vaccines. At some point, that switch is going to flip, and we're going to be at a point where supply exceeds demand. And when that is the case, it is imperative that we make it as easy as possible for people to get it. And in fact, what I envision is, I know people have gone to their primary care physician because they had an earache maybe in September or October, and while they were there, their primary care physician said, "Hey, while you're here, you want to get the flu shot?" And they said, "Oh, sure, I'll get the flu shot." Well, we want to make it as simple as that as we move into mid to late spring, and that's what we're continuously trying to do. It's important, obviously, and we're going to continue to work to make that happen. With that, I'm going to turn it over to Mac, who is going to give us an update on the emergency management.
All right, thank you, Governor. We're going to brief out on three main areas: the winter weather event, Hurricane Zeta, which our response still is ongoing, and also some moderate to minor river flooding, and some good news there, though, as well. So we had one additional death in Simpson County that was reported, so that brings us up to 6 for this weather-related event. Three of them were in automobile accidents, vehicular, and 3 from exposure. Our damage assessments are ongoing. At the latest report, at the height of it, we had about 16,000 homes that were affected, that being entire counties frozen in, no one be able to drive the roads, et cetera. We're ending up with some numbers. 11 homes have been completely destroyed, some of those due to storms, some of those due to faulty fire apparatuses in the house, which happened to consume those houses. 25 with major damages, 49 businesses and farms affected so far. If we look at our electrical co-ops, the state of Mississippi right now, they are giving me a tentative number of $14 million worth of damage. If you remember, the state threshold is about 4.5. So in those counties in which those co-ops are in, it seems like we're looking good in that area. And we're continuing to get 36 counties reporting on that side, and we've got also about $4 million worth of damage for a total of $18 million reported by the counties. So about $14 million for the electrical co-ops, and then about $4 million for the county so far. And we are looking at requesting by about Wednesday to Thursday of this week and trying to do joint damage assessments with FEMA to start our federal declaration request. So we're starting to get enough numbers in where we know that we can make our gates that we need to. Currently, in our water distribution, we've distributed about 524,000 bottles of water statewide. You've got probably about 220,000 that have been distributed to Hinds County alone out of that group. If you look at all of our water associations across the state, about 77 to 78 were under some type of boil water notice at one given time during this ice storm. Restoration is approximately 56 of those have been deemed safe, so we've got about 21 to go. So progress is definitely being made in this time on the backside of this storm. We continue to, we extended our water tankers for the city of Jackson all the way through Friday. It seems like just a few moments ago, just before we walked into the meeting, that they've discovered a 24-inch line in South Jackson that is the main feed line going towards South Jackson and Byram. So we're going to continue our efforts to support those tankers in that location as the pressure in the rest of the city is starting to get equitable, and their pressure is good. We made that commitment to them to help out those areas of the city of Byram and that South Jackson location. And that was just found out not too long ago. So we're going to be there. There's also another area of our state that's affected, and that's our farmers during this ice storm. So that I need to be able to let them know that you need to go to farmers.gov, or you can dial 601-965-4300 to talk to the Mississippi Farm Agency for any of your crops that might have been impacted during that time. Proud to say that Hurricane Zeta, the application period has now closed. That closed at midnight on Monday, so we had 16,803 applicants for the state of Mississippi during that time. For total registrations, 3,800 were approved. Total distributions for housing assistance and other needs assistance to individuals, $13,321,000. So that is a significant helping hand to those individuals that needed that. And also our SBA loan program that the Small Business Administration, over 17.9 million total number of dollars loaned out to businesses, 837,000 homeowners were able to refinance at a very low rate of about $17 million. Very significant things going on with that. Lastly, about the flooding, we've had some minor to moderate flooding in a few of our rivers in the state. The Yallabusha around Whaley, the Big Sunflower River in Sunflower, Big Black, Tom Bigby, and the Putahatchee. But I'm proud to say that from last year's levels, the Mississippi River, we are averaging from all the way from Greenwood all the way to Natchez, we are from 15 feet to almost 35 feet lower than we were last year. So we have some capacity in which we faced multiple disasters at the same time, along with COVID. As we all know, this is good news to start this season at this level. Governor, that's all I have for this time.
Thank you, Matt. Again, I want to personally thank the men and women at the Mississippi Health Department, Mississippi Emergency Management Agency, the Mississippi National Guard, and all of our partners throughout our state who are working overtime, literally working overtime, to do all of the things that need to be done. You know, it's when you think about the issues that have been before us over the last year, it just should be noted that Dr. Dobbs, for instance, has a large number of employees that are out helping ensure that we vaccinate people, while at the same time his agency is responsible for the clean water notices and boiled water notices, and it's just a lot of challenges have built upon one another, and it's a lot of people are putting in a lot of extra hours, and I'm personally very, very thankful for their efforts. And so with that, we'll start with Courtney Ann and work our way around.
Governor, and Dr. Dobbs, kind of a dual question here. So I'm looking through that public health alert that you were just talking about. Was there any consideration of making that a part of this order in a similar way that you did with, I guess it was maybe the Safer at Home, where you included a portion of the population that was most at risk to say, hey, we're not telling you that you're good to go?
From my perspective, Dr. Dobbs and I met and talked about the public health order late last week, as we've been talking over the last week as to the direction that I was headed with respect to the EOs. I will tell you that I think we probably sent out the actual signed EO, which goes into effect tomorrow at 5, obviously. But in the EO, it is very clear that we continue to recommend for those who are not vaccinated, particularly for those that are in higher risk categories, to wear a mask, to continue to do those little things. So, one of the things that we've talked about and various individuals have said is, we're not at the end of the tunnel, but we certainly see the light at the end of the tunnel. And if you are currently one of the individuals who are over the age of 65, and you, for instance, have an appointment scheduled to get the vaccination a week from now or 2 weeks from now, what I have seen is that individuals have really scaled back because they know they are so close to getting that vaccination. And I think more and more people are now that they have been scheduled. We had new appointments that have been out there today. And so I think what I would say is that we continue to recommend, particularly those that are in the most vulnerable category, to do those little things to protect themselves. If you look at the total vaccinations, one of the things I'm most proud of, we in January and February, we inoculated a lot of people in our state. And I'm very pleased with the fact that of those that have gotten their first dose, approximately 330,000 of them are over the age of 50. And if you look at our total hospitalizations in Mississippi since March the 12th, when we had our first case last year, a huge percentage of those fall into the category that are over the age of 50. And so we've really tried to target those areas that are most, that are the individuals that are most vulnerable. Of those that have been inoculated, 225,000 of the first doses have gone to people over the age of 65, and 135 or 140,000 Mississippians over the age of 65 have gotten both their first and their second dose. And so all of those numbers are extremely encouraging to me. I wish and I look forward to the day that upwards of 100% of all those individuals over the age of 65 particularly have been inoculated. But part of that is going to be an education process. Not everybody over the age of 65 wants to get it. But given the fact that we have been successful in getting to this point where we've done, by tomorrow night, right at 700,000 inoculations, we've got just in our state-run sites about 100,000 additional appointments already made over the next 3 weeks. We're opening up 8,000 new J&J appointments for those individuals who want to choose to get J&J. And just as a reminder, when I got my flu shot earlier this year, I didn't ask my doctor which manufacturer made it, and I didn't ask him what the efficacy rate was. What we do know is in all three of the vaccines, and I've read this, I'm not an expert on it, but all three of the vaccines significantly reduce. They don't eliminate, but they get really, really close to eliminating the risk of hospitalizations and extremely severe cases. And so, I think what was said by many of the folks on the task force this morning is when you are eligible and when you are able, get the vaccine you can get as soon as you can get it. That's what a lot of people think, but every individual's got to make their own choice. And so certainly we continue in the executive order to make those recommendations, and Dr. Dobbs's public health orders are in line with that, and I am fully supportive of them, but I don't know.
Yeah, so, of course, we're extremely glad to see the decline in cases and deaths, but we're going to still combat this. if you look at the numbers of folks who've died or had been hospitalized, it's mostly folks who are over 50. And if it's folks who are younger than 65, most of them have diabetes or maybe underlying vascular disease. And if we can get all those folks taken care of, we'll really take care of that problem. So please get vaccinated if you're in that group. We'll still have cases. I don't want COVID even if it doesn't kill me. I mean, we know it can make you sick. You know, 30% of people may have this sort of long hauler sort of situation going on. So let's please continue to exercise caution, because there's still bad stuff that can happen if we let it perpetuate.
How important was it for you to go ahead and put that alert out, even though it's not in conflict with the order, but to say, hey, the governor's asking that you look to us to say what's the recommendation, and that we make it clear we're not saying go and do what you were before any of this.
Yeah, no, they're complementary. I think making sure that we protect the vulnerable, and that's going to be the key thing right here.
Yes, sir.
Dr. Dobbs, coming up soon is spring break, but this order will allow bars and other recreational facilities to open up a bit more. I was curious, on one point, could Mississippi see another surge of the virus if people go out and have blatant disregard for what's been going on for the past year? And also, do you think this is a good time to start to roll back on some of these orders?
So, yeah, of course, we can have a rebound, especially for folks who are not immunized, getting together. The same simple things. Mississippi didn't go overboard, right, on the restrictions, and common sense stuff works. We were back in school and were able to do that quite nicely. I think the same thing goes with spring break. Do stuff outdoors. Don't group together indoors with a lot of folks. There's no way in heck I would go sit in a crowded bar right now. And indoors or out, really. So please exercise caution right now. There are safe things to do. If you're outdoors at something and you're spaced out nicely from other folks, it's going to be pretty safe. But you can catch COVID, and we can mess this up, right? So please help us just be a little bit cautious, especially going through spring break.
Yes, sir.
Thank you, Governor. Kind of like along the lines of what everybody's been asking and what we've heard from Dr. Dobbs and yourself. How do you make sure there's no mixed messaging here? If I'm somebody out in public and I hear no more mask mandate, I hear that all businesses can be at full capacity, yet then we hear from Dr. Dobbs, still avoid mass gatherings. I mean, for a lot of businesses, full capacity could easily be mass gatherings where no masks are required. How do you balance that out with the threat is still here if there's no mandate?
Yeah, so that's a great question, and I think it's a fair question, and it's one in which I want to be very, very clear here, and that is what I have said from the beginning is that we are going to do everything in our power to ensure that if someone gets this virus, or if someone has another medical emergency, that if they can get better with quality care, that they receive that quality care. And so while I look at the daily cases every single morning, in fact, I get my phone really early and start waiting for it to come in so that I can know what the daily cases are. And it's important that any decision maker does that. But that is, total number of daily cases is not the end-all be-all in my decision-making process. What is the end-all be-all, and these single most important issues are, what do the total number of hospitalizations look like? What are the total number of patients that are in ICU beds? What does it look like? And what are the total number of patients that are on ventilators? At the peak, Mississippi had 1,450 patients COVID positive in our hospital beds throughout Mississippi. That number is 420 today. We are down 70%, really 72% from where we were just 2 months ago. If you look at total number of ICU beds that are full with COVID-19 patients, at the peak, we were at about 360. I believe it was 357 at the peak. Today, that number is 120. Again, down almost 75% from the peak. If you look at those who are currently on ventilators, the numbers are very similar, where we have basically less than 100 that are on ventilators in our state. And so my goal has never been to eliminate and ensure that no individual ever gets COVID, because that's not a realistic goal. It hadn't happened anywhere in America. It hadn't happened anywhere in the world. And it's certainly, no matter how much we encourage individuals to do the right thing or mandate individuals to do the right thing, the virus is contagious, and that's just reality. But what we can do is ensure that we protect the integrity of our healthcare system. The only thing that justifies the kind of executive action that has been taken over the last year is to protect the integrity of the healthcare system. And that's what we focused on. And so there is no mixed messaging. The message is very clear. If you get COVID today, there's going to be a hospital bed available for you. That doesn't mean that it's a good idea for you to go out and get COVID, right? It just simply means that now, if you go into a bar without a mask and you're 75 years old and you have pre-existing conditions, you're taking a much bigger risk, and you haven't been vaccinated, you're taking a risk. That may be a risk you're willing to take. It's not a risk that I would be willing to take if I were you in that category, but that's why the messaging is important, that we continue to have recommendations. We continue to suggest that you do the right thing, that you are smart, that you protect yourselves and protect your neighbors, but the government is no longer telling you what you can and cannot do. And the reason the government's no longer telling you that is because of the actions that we've taken over the last 12 months has gotten us to a point where our total hospitalizations today, the second day of March 2021, is about where we were in late May of 2020. Now, of course, we know what happened in late May, and we know what happened in June, and we got that first initial significant uptick. And while it is certainly possible that we could see something like that, it's not likely we're going to see something like that, but we are going to continue to see cases. And so the next time I see y'all, if we have 100 more cases that day than we have today, or 100 less cases, I'm not going to be surprised. We're going to continue to see cases, just like we continue to see flu cases every single day. So we're going to continue to see some of the spread of the virus. Now, each individual is going to choose to either attend or not attend based upon what their risk tolerance is and based upon what their willingness is to have gotten the vaccine or not gotten the vaccine. But this is what I recommend. If you're over the age of 65, or if you're over the age of 18 and have pre-existing conditions, comorbidities, don't be in large crowds, whether it's at your home or someone else's home or someone's restaurant or someone's bar or whatever, if you hadn't gotten vaccinated. To me, that risk-reward scenario doesn't make sense.
A quick follow-up, if I may.
Sure.
Quick. Does this executive order allow city and county governments to still have mask mandates and certain requirements on businesses?
This executive order does not forbid local governmental entities from doing those things.
So they can get more strict if they wanted?
That's always been the case in Mississippi. They can't conflict with the order, but they certainly, if they believe that's in their community's best interest, then they currently have the ability to do that. Yes, sir.
Dr. Dobbs, you mentioned that Johnson & Johnson's on the way at some point. When might Mississippians expect to see Johnson & Johnson vaccines in the state?
We ordered them yesterday, so I do think, we'll probably see them by tomorrow being delivered. So they're pretty fast.
Midnight tonight.
Yeah.
Really
Don't line up anywhere. Just, yeah.
Could they be scheduled midnight or in a few days?
Well, this afternoon we'll be able to schedule drive-through appointments for Thursday and Friday this week. So we didn't start it off tomorrow, just want to make sure we get the vaccine. But yes, so starting Thursday and Friday, you can start getting, you can get an appointment now for drive-through Thursday and Friday for Johnson & Johnson. Now, it's only going to be the few locations where we had available space, so where our teams were not were already occupied. And right now, I believe it's going to be Madison, Jones, Lauderdale, and Lowndes. And those were chosen because we had those sites open and not otherwise occupied with Moderna and Pfizer this week.
Not completely full. So we're doing vaccinations there, but not completely full.
Yep.
The other thing I will tell you, and I should know the answer to this, but I did see some comments from our friends in Kentucky that the Johnson & Johnson vaccine is being distributed by McKesson out of those two facilities in Kentucky. We've got two facilities that are also doing that in Mississippi. I don't know for sure. I don't know for sure if our McKesson facilities are distributing J&J or not, but it could very well be that not only do we have Mississippi's Johnson & Johnson doses in Mississippi, we may have a lot of other states here as well. So, but I don't know the answer to that for sure, but my guess is that contract is for all 4 sites to do the distribution. Yes, ma'am.
This is mainly for Dr. Dobbs. How does a person decide which vaccine, now that there are 3, which vaccine is best for them, and is there a recommendation for that?
Yeah, no, that's a fantastic question. So, so I think a lot of it just depends on your preference, right? So the Pfizer and the Moderna seem to be pretty much equivalent, and so we don't really parse out between them. They have the same sort of efficacy as far as, you know, almost identical. Storage is different. That's the challenge, and that's for us to deal with. So for the Johnson & Johnson, though, if you really want a one-shot vaccine to be done, you know, it's really attractive, and a lot of folks want to do that. If, you know, you're really wanting to get that bang for your buck, the one shot, but also has, you know, same sort of order of magnitude improvement in severe illness and death, you know, Johnson & Johnson's there. But, you know, if you're really looking at it and say, you know, this is the Pfizer and the Moderna have a little bit better profile on preventing any symptomatic illness, yeah, they have a little bit better numbers. And so it's really a patient choice issue. I'd be comfortable getting either one of them, you know, but I think the best vaccine that there is for you is the one you can get right now. Honestly, this is where the risk is. It's right now, and encourage everybody to get vaccinated, but want to also let people have some choice.
Jacqueline Massey with Fox 13 in Memphis has a question.
Oops. Hi, sorry about that. Just talk about reaction to being like almost a year that we've been dealing with living in this pandemic and dealing with COVID cases, and talk about how this is such a big step that you guys are basically allowing people to choose whether to wear a mask or not, obviously being encouraged. But let's talk about your emotional reaction to being where we are right now.
Well, what I would say to you is that this is a very good day in what has been a very, very challenging year. There's no doubt that we are, as a state, in a better spot, just like we are as a nation in a better spot because of the additional tools that have been brought to us by the absolute innovation and hard work of these companies that have been successful and quite frankly, Operation Warp Speed put in place by the former administration to get these vaccines done very, very quickly. We are seeing a large number of Mississippians and a large number of Americans that are willing to jump out and take that vaccine. I'm very pleased by that and quite frankly relieved. Now we got to continue to message and we got to continue to encourage those individuals that some of whom may still be skeptical. I think the skepticism is becoming less and less as we go, as more and more individuals get the vaccine. I hear just anecdotally more and more people saying, well, you know, you've had it for 3 or 4 weeks. You hadn't grown an extra horn out of your head or an extra arm out of your back. So, you know, and I don't mean to make light of it other than to say I think people are getting more and more comfortable with it. Even you see some of the national polling out there and what may have been 50% of Americans were very concerned. Now that number's probably half of that. And so the point is, particularly for those that are most vulnerable, if you're over the age of 65, really over the age of 50, if we had 100% of those over the age of 50 vaccinated, our hospitals would have very few people with COVID in them. I mean, we have a lot less today than we've had in basically 7 or 8 months, but we drive that number down even further because most of the people in the hospitals today even are either over the age of 50 or have pretty significant and serious comorbidities. So from an emotional standpoint, I tell you, I'm relieved, I'm happy, I'm pleased, but I'm also want to be very serious about there are still risks, and everybody's got to be very smart going forward. And if we do approximately 25,000 inoculations a day, which is about what we've been averaging for the last week or so, every single day that passes, we get a little bit closer. And every single day that passes, the risk becomes a little bit less. Because, as you've heard me say before, the best way for no one to get COVID is for no one to have COVID in whatever room or hopefully outdoor area you happen to be in. That's the best way to not get COVID. And so we got to continue to drive those numbers down.
Nick Juden of Jackson Free, or Mississippi Free Press has a question.
Hi, yes, for both the governor and Dr. Dobbs. I've spoken to a lot of essential workers in retail, especially on the front lines of this pandemic through the last year. They've counted on mass customers to perform their jobs safely. So why is Mississippi opening up before all frontline workers have access to a vaccine? And I'll have a quick follow-up.
Sure. Again, we have prioritized those individuals that are in that most vulnerable category. There are an awful lot of frontline workers that fit into that area. There's nothing within this order that prevents a business from suggesting that their customers or their employees wear a mask. In fact, I think you'll see a lot of them that choose to do that, and I think that certainly in certain areas could make sense. There's nothing. There is no executive order that forbids individuals from protecting themselves from wearing a mask, and in fact, I encourage them to do so.
Yeah, and I do want to reiterate the piece about vulnerable folks getting immunized. If we look at the population of Mississippi, probably half of all essential workers qualify already. And those are the people who are going to be at high risk for severe disease and death. So please see if you qualify and get vaccinated. It's easy if you're over 65, but it's a lot of folks if you're overweight at a certain level, if you're a smoker, if you have diabetes, you qualify for vaccine. So get vaccinated now. I think the vaccination is going to make a huge impact for us going forward. There's no doubt about it. But I still think that it makes a lot of sense to wear a mask in public, and I'm going to do it. When I'm out around strangers, when I'm not in my household, I'm going to wear a mask, and I'm going to avoid mass gatherings. I think we got a little ways to go, but that's my decision, and I hope a lot of us decide to do that we take that personal decision to do that.
And let me just say one other thing, and then we'll let Nick follow with his follow-up question. We talk a lot, because we run it, we talk a lot about the mass vaccination sites, and we talk a lot about the fact that there were thousands and thousands of new first dose appointments that went online earlier today. There are still those available. There's also there's also a large number of now J&J appointments in certain areas of the state at our mass vaccination sites. And that's important. And so you can go online, you can go to our call center and get those appointments scheduled. But I also want to be very clear, this week we're actually going to have more vaccine distributed to our partners than we are doing at our mass vaccination sites. So it's about half and half. So about half of all the new first doses that we have are at those mass vaccination sites. And so there are hundreds of other places, whether it's Walmart or Kroger or FQHCs or your local pharmacy or your local hospital or your local primary care clinic. Again, hundreds of places where an individual in Mississippi can get a vaccine. And we encourage you, again, Dr. Dobbs said something that is so important. Again, consult your physician, do your own research, but most likely the best vaccine for you is the one you can get most quickly in the place you can get it. So, yes, sir.
Thank you, Governor. I'd like to dive more into the numbers about what went.
I'm sorry. We'll come back to me. Go ahead.
Oh, okay. I'd like to dive more into the numbers about what went into deciding these mask mandates are no longer needed. So you had mentioned the hospital numbers, and you had said that no counties are currently at the rate requiring the mask mandates under the old rules. But are you at all concerned that it was the 2 ice storms that just passed that really made people not go out as much to get tested or not go out and realize they had it, checking in with their doctors, and because that would mean we're possibly worse than what the current numbers are showing, with the ice storms making a lot of delays?
Well, I do think it's a fair point that the week before last, which was approximately a number of days ago, 10 days ago, there's no doubt that there was definitely less testing in Mississippi because there was ice, certainly from Hattiesburg north, all over the state. So there's no doubt about that, that I think our total numbers last week and the week before, particularly the week before, were less than they otherwise would have been in terms of total positive cases. Having said that, the numbers that don't lie and didn't keep people from taking action if they needed to take action were the hospitalizations. So, if we had ice on the ground and you were so sick with COVID that you needed to be admitted to the hospital, you figured out a way to get to the hospital most likely. In some instances, we actually sent first responders to get people. We had ambulances that were running during that time. And if you look at it, on a weekly basis on Sundays, and this is on the Department of Health website, I look at it pretty regularly, but on a Sunday, the peak total number of hospitalizations was 1,444. This past Sunday, 2 days ago, it was 413 total patients in the hospital bed. And so I do, yes, agree with your premise that 2 weeks ago there was less testing and therefore perhaps a few less positive cases. And we saw a slight uptick in the middle of last week in our 7-day average. Again, still 80% below where it was at its peak, but still a slight uptick compared to the week before. But I don't think that affected the hospitalizations considerably, and therefore, again, I'm not at the point where if your question is, are you concerned, my answer is not still yes, because it is. I'm concerned about all of these things, as it has been the case from the get-go, but I think that the numbers certainly speak for themselves. Let's go to Nick. I forgot he had a follow-up.
I forgive you. So for Dr. Dobbs, who is in the next vaccination group and when can they expect eligibility? And for Governor Reeves, when are you sitting down with legislative, City of Jackson, and potentially federal leadership to address the long-term challenges of the Jackson water crisis?
Well, my question's easier. So the governor and I will sit down with our teams and talk about, we'll look at the numbers, look at the demand, see if there's any sort of flexibility in the system to expand and who that next group will be. So basically, don't know. We've talked about some different options. I do think there'll be some likely expansions in the near future, perhaps, but we'll continue those conversations.
Yeah, and I'll just say, the longer those first dose appointments stay available, the more likely we're going to expand, because what we want to ensure is that every single first dose we get this week, we put them in an arm this week. That's where we are. We are at maximum utilization. It was a slight hiccup 2 weeks ago because of the ice storm. We know that. But and I've told the administration this, because they want to distribute vaccines through all these different programs, and we're not necessarily against any of them. But as I've explained to them, if you send us first doses, we will get them in arms within 7 days. That's our goal. We've got a mechanism in place to do it, and we are consistently doing it. Thank you for forgiving me, Nick. I appreciate that. Forgiveness feels good, always. And so just to be clear, with respect to the challenges that are faced by water systems in the city of Jackson, which has certainly got a lot of attention, I just want to make sure everybody understands that at the height of the ice storm, Mississippi had 78 water systems that had boil water notices. In other words, we had 78 different systems throughout the entire state that are having and experiencing challenges. This is not an issue that is unique to our capital city. In fact, today, we still have 21 water systems that are under a boil water notice and that are having different degrees of challenges, but 21 different water systems have not been able to convince the Mississippi Department of Health that they have clean water and they don't have to do boil water notices. And by the way, everyone's held to basically the same standard. So I want to point that out. With respect to the city of Jackson, I have personally texted back and forth with the mayor. My chief of staff has repeatedly conversed with the mayor of the city. My chief legal counsel has discussed with the mayor repeatedly various issues, and my chief policy director has sat down multiple times with the head of the Public Works Department with the city of Jackson. And so we are those conversations are ongoing, and I don't know how many hundreds of times Mac and his team have had conversations with the city of Jackson over the last 20 days. In fact, during the last week and a half, we have, as a state, again, we have distributed 524,402 bottles of water. That's distributed statewide. Of those, we have distributed 217,350 bottles of water in Hinds County alone. Again, what that tells you is that we have, on total bottles of water, about 40% of all of our distribution has gone here in the capital city. But that means there's 60% of the requests that we have met have been outside the city. So it's simply a reminder that this, again, is not unique to our capital city. The size and the scope certainly are much larger here. And what we are going to have to do is have a serious conversation long term with all interested parties, and that's very important. So, yes.
A quick point of clarification that I had someone ask me about and I had not noticed it. In the order, it references 16 and older with pre-existing conditions, but on the website for the scheduling, it looks like it only lets you schedule an appointment if you're 18 and older. So what about those 16 and 17?
Yeah, so we're working on that. The problem is that Pfizer is for 16 and older, Moderna is for 18 and older, and we can't have people coming to getting the wrong vaccine, and it's not easy to do. So we're trying to work out a solution where people can call or maybe do a special selection for a Pfizer. Now, certainly in a private doctor's office, that's fine, but it's just because the difference between Pfizer and Moderna.
Thanks. Dr. Dobbs, this is a question for you, if I may. I believe the latest report we found, as of last night anyway, about 10,000 households and businesses in Jackson do not have running water. Is your department at all concerned that with people lacking the ability to shower often or bathe often, leading to the possibility of I don't know the specifics of catching COVID or getting more sick, making them more vulnerable to catching COVID because they can't bathe without access to running water?
Yeah, basic sanitation and water is a foundational component of health, right, and public health. I mean, it's one of the first things that made a difference in the turn of the century to make sure people are healthier. So, we've been working closely with the city. We do have a specific role in that as far as making sure that the water is safe as far as from contaminants, whether it's bacteriological or lead or copper. So, we're working closely with them. This is a long-term play, right? It's something that's going to take a long-term fix, and there are tools that we'll have to offer. We do also do we manage the revolving loan fund for repairing water systems. So there'll be opportunity in the future, and so we'll continue to stay engaged. But yes, of course, it bothers us, and we're very concerned.
John Scott with Fox has a question.
Hi, thank you for taking the question, Governor Reeves. This is COVID related, but a little off of the day's news. I know that obviously Mississippi has not expanded Medicaid, and as part of the COVID relief legislation that's going to be considered in the Senate this week, there is a new incentive, a funding incentive for the states that have not expanded Medicaid to expand now. It's an extra 5% bump in the federal funding match. And I was curious whether that would prompt you to reconsider at all whether Mississippi should expand Medicaid, given that new incentive.
No, sir, it will not.
Sarah Bullen with Y'all Politics has a question.
Hey, Governor, when you talk about businesses not operating under any state mandates, would that include the curfew that's been placed on bars and other things like that for 11 o'clock, or is that just referring to capacity limitations?
No, that would include the reduced hours of service that was put in place months ago, effective 5 o'clock tomorrow, if I'm not mistaken, will no longer be in place. And it will no longer be in place just a matter of whenever the executive order goes into effect. And I need to just make sure I know that. Tomorrow, that's right. Yes, sir.
Thank you, Governor. This is something that's a little bit recent. I don't know how familiar you are with it, but the City of Jackson Council voted to pass a resolution sending to the state legislature about a 1-cent sales tax to go towards repairing water infrastructure. As you said, a problem that is nothing new in Jackson. Would you support that 1-cent sales tax to go on the ballot for the City of Jackson since they got to go through the state legislature to get that approved?
Honestly, I haven't seen the proposal. I think that most things should be on the table, but I do think it's really important that the City of Jackson start collecting their water bill payments before they start going and asking everyone else to pony up more money. I think that's been a long-standing challenge for the city. I think they will admit that. Clearly their billing system is flawed at best, and so there's a lot of things that need to be fixed and need to be discussed, and we'll certainly be willing to do that. Bailey.
Patrick, you with the Sun Herald has a question.
Yes, I have two quick questions. The first one for Governor Reeves. I just want to make sure I have clarity on this. As far as it goes, seating capacity at outdoor and indoor facilities, they will both operate under 50% capacity. Is that right?
Indoor facilities at 50%. There are no restrictions on outdoor facilities.
Okay, all right. Dr. Dobbs, I've read elsewhere that they're having problems with people not showing up for their second dose appointments. Have you seen that as an issue at all in Mississippi?
We've had a small number of folks, but it's been a minority. Like in a week, it might be like 800 people out of many thousands, out of 30,000. So it's a small number. Some of them, they just forget, and we try to reschedule them. We've had pretty good follow-up for our second doses. I can't speak so much for the private docs, although just looking at their numbers in total, they're pretty good. But there will be some loss of second dose appointments. There's just no doubt. But overall, we can pull some precise numbers for you, but it's looking pretty good.
Yeah, I've monitored that very closely, and while there are some challenges at the margin, when you're getting 95+%, I don't think it's a major challenge.
Blake also with the Daily Journal has a question.
Yeah, I have a quick clarification question for Governor Reeves, and I apologize if this has already been answered. I see that seating for K-12 extracurricular activities at outdoor venues is set at 50% and 25% for capacity inside. And I was wondering, I see it says seating capacity for indoor bowl and arena seating increased to 50%. Does that apply to colleges and universities as well?
No, that's just for K through 12.
Okay. So what are there any limits on colleges and universities still?
There's a 50% limit on indoor venues. There are no limits on outdoor venues for colleges and universities. Bailey.
Thank you, Bailey. Thank you, Governor. This question would be for Dr. Dobbs, but Governor, if you would like to chime in on it as well. Since the third vaccine, the news was announced today, is there going to be any, I'm not necessarily sure if anybody's community contact or anything as such, but since this vaccine has come out, is there still going to be the equal number of opportunities for schedules for 1 and 2 vaccines as well? Thank you for your question.
I think I understand your question. If I get it wrong, y'all get me back on track. So we pretty much have maxed out most of our drive-through locations. And so we were able to augment this week and the first part of next week with 8,000 doses because we had the venues where teams were not operating those days. And so we will fill the gaps. So at the drive-through locations, we've already booked out, 100,000 folks plus. And so most doses that are going to be going at the drive-throughs are going to be Pfizer and Moderna. We will layer in Johnson & Johnson as it's available, in addition to sharing it with our partners. We don't have a good visibility on what our next week's allocation for Johnson & Johnson is, but we're going to try to use those 24,000 we get as soon as possible.
Yeah, and I'd just say that we don't have good visibility other than we know that it's likely that next week and the week after that and the week after that, we're not going to be anywhere near the level of 24,000 that we get this week. So it's going to come down, and so that's why it makes such good sense that we are getting 8,000 shots in arms at our mass vaccination sites, plus using our distribution network, because this 24,000 plus a few more is really a 2 or 3 week supply. Now, by April, we think that's going to be on more than that on a weekly basis, but it's going to take us the next 3 or 4 weeks before that supply heats up. Yes, sir.
Yes, for a question for Dr. Dobbs. The University of Mississippi Medical Center released a study recently looking at COVID spread among children. It found that it goes a bit it's easier to spread than they anticipated originally. I was curious, the governor's order extends orders for schools. Do you think that's going to be an effective way to continue limiting transmission among children, ultimately to their unvaccinated family members? And also, what would be your advice to parents using this new information to tell them how to keep their children safe?
Yeah, so, and there's been some other stuff that's come out of the UMC also looking at transmission risk. In the school setting, it seems like that kids mostly catch it outside of school. They catch it at a sleepover. They catch it at a party, a birthday party, those sorts of things. So we do know that the things that are in place to protect kids in school work. Are there vulnerabilities? Of course. Extracurricular activities, school buses, and lunch and stuff like that. So yes, we early on, if you'll remember, there was this sort of theory that kids can't spread COVID, and I think anybody with lick of sense never really bought into that. But it's not surprising that kids can spread COVID. They just don't get as sick from it. Some do, but not as much. So I do think that these very simple safety measures make a ton of sense to keep kids in school. Our objectives are to keep kids in school. If they're out on quarantine, they're not in school. So it's better to keep them in school. And these same things can help protect parents, but I do just want to say to parents, please remember, when you get kids together in a big group, you're going to be at risk. And then when you get them together with grandma and other folks, there's going to be risk. So 2 things to do is, limit, exposures, but also to help grandma get vaccinated. We want to protect her.
Gabby Sisman-Zobska from the Clarion Ledger has a question. I'm sorry, I butchered her name.
Hi, that's all right. Thank you so much for taking my questions. I have just a quick clarification question and a follow-up to that. So I understand that there is a state of emergency in place for the winter event we had, but I was wondering, has an emergency been declared for the water crisis in Jackson? And if not, what would be the threshold to declare an emergency for it?
Well, the emergency is in place for has been declared at the state level, we have required each of the counties that have been affected to get their data in. As you are aware, for there to be a federally declared disaster, it requires $4.5 million worth of damage. As of today, and this was not necessarily true as of Friday, but as of today, we have adequate information that has been put into the system that suggests that we can likely ask for and receive a federally declared disaster, which is a very positive thing. And I'll turn it over to Mac to just fill in any details that I may have missed.
Yeah, what happens out with that $4.5 million threshold is that is spread out to every county as well. They have to meet their per capita rating. We have the counties that do state of emergencies or local proclamations of emergency, and then the cities within those counties do their local proclamations of emergency. So it's a tiered system that we look at and that FEMA grades us by. And all those damages, we've asked every county. We were on a county call the other day. We'll have another one Thursday of this week, saying that we need your damage assessments in because when FEMA comes to town on the 9th, and that's the day that we're asking them to be there because we think we can be prepared for that because the state has to assist them. And we go out and we do damage assessments together. That is the final gate as we're trying to submit our federal declaration. So there's a tiered system. We're working it, and as the city of Jackson gets their damages, they roll them up to Hinds County, they roll them up to us, and then FEMA and all of us, we go out there, all three, federal, state, and locals will be looking at the damage to see what is eligible, what is not at the end.
Just to say a few more things about that. To my knowledge, Hinds County has not yet provided damage assessments to the state of Mississippi. It is highly unlikely that there would be an emergency declared simply for that issue because it would be taken into account in the emergency that's been declared for the whole storm itself. The other thing that I would just point out, and I don't want to say too much, but I do want to be clear that the federal government and FEMA reimburses for natural disasters, and it is imperative that Hinds County and the city put their damage assessments into the system such that they hopefully will meet that threshold. Yes, sir.
Thanks. This is just out from President Biden within the last nine minutes. It's a quote he made in his latest briefing. Quote, "This country will have enough vaccine supply for every adult in America by the end of May." Just want to know real quick, what do you make of something like that?
I hope that is accurate. Obviously, we are seeing increases in supply as we would anticipate on a weekly basis, and it would take roughly, I would think it would take 400 million doses or so by the end of May for that to be the case. Maybe 500 million doses, depending on what the breakdown is, how many of those are Johnson & Johnson. But certainly we think that we are literally several months away from having pretty universal access of the vaccine in our state and across the country, and that's a good thing. Nick?
Yes, Governor Reeves, I noticed in the Facebook feed below this press conference, and I usually don't focus on these, but I did want to address one thing that I saw. Someone posted, "First person to tell me I got to put a mask on to enter gets slapped too." So I want to ask you, what is your message for the people who take this announcement as proof that they don't have to listen to businesses, they don't have to listen to cities, counties, that masks are done, that the restrictions are gone, and that we're through with this?
I would simply reiterate what I've said throughout the pandemic, and I believe that mask shaming on both sides, those who shame you for not wearing a mask as well as those who shame someone who chooses to wear a mask, is wrong. It's counterproductive, and it doesn't do anyone any good. Each individual needs to do what they believe is in their own best interest, and I think that we as a society, and by and large, the vast majority of Mississippians understand that and appreciate that. We love our neighbors, and we care about our neighbors, and there's just, we're in an odd spot in the country now for lots of different reasons, but by and large here in Mississippi, we love each other, we love our neighbors, we want everybody to be successful, and we want everybody to do good, and we want to pray for people to be healthy and happy, and I think the vast majority of Mississippians will do that. Well, we've been here almost an hour and a half, and I really do appreciate all the questions from each of you, and I'm sure we will get back together soon, but in the meantime, I hope everyone out there stay safe, and God bless.
Thank you, gentlemen.
Thank you, sir.
Have a good day.
Thanks. Sure.